Well, as Kelly mentioned, the Omicron variant sending COVID numbers soaring across much of the country. Many health officials struggling to keep track of new cases, deaths, and hospitalizations. More than 300 million people worldwide have contracted the virus. Now, that's nearly a fifth of those cases here in the U.S. But some healthcare experts warn those numbers are actually significantly underestimated. Correspondent Brian Enton is live for us. So, Brian, there's a potential discrepancy between those reported numbers versus the real numbers.
Yeah, Nicole, there's definitely a lot of focus on the numbers overall. We're out here at this Miami COVID testing site. I just got an alert on my phone about the latest numbers here in Florida. They broke another daily COVID record here in Florida. But again, so many questions. Experts say there is no way to actually get a truly accurate count, and it's almost impossible to track the number of people who have recovered from COVID. We've seen the long lines for COVID tests, and the numbers have reflected it, with doctors and testing sites seeing a surge like never before.
The numbers have really escalated, and when we came back after New Year's, it was like, almost like nothing we had ever seen, even in the height of COVID previously, maybe a year or so ago.
Numbers escalating, numbers of cases, numbers of deaths. We hear about COVID numbers all the time, whether they make us feel better or more nervous. But the truth of the matter is, most experts say while the numbers matter, they are not accurate.
How reliable really are the numbers?
Oh, they're an underestimate. They're a vast underestimate.
The latest count from Johns Hopkins University shows the U.S. has had 59 million COVID cases and almost 9 million in the last 28 days. But infectious disease expert Dr. Eileen Marty says COVID cases are likely 20% higher than the numbers show. Part of the reason is because so many people are using at-home tests.
The at-home tests are so popular now. Most of the people I know aren't reporting the numbers. Do you think that's a big problem?
It is. It's a problem because it gives us a false sense of security. And it doesn't allow us to recognize exactly where the hot spots are.
Remember, a surge in cases usually comes weeks before a surge in hospitalizations. And Dr. Marty says not knowing where the hot spots are is especially troubling because additional resources can't be sent in before hospitalizations get out of control.
There's always going to be a problem with numbers, and nothing's perfect. You've got to get to as close as you can, and you do estimates, and that's what we've always done for all kinds of diseases.
And it really gets complicated when you try to start tracking the amount of people who have recovered from COVID, because so many people we know have COVID and recover and never even really know they had COVID. And experts say it's important that they have accurate numbers. The real reason is, again, because they need to know where the hot spots are. If the cases start surging in an area, they know that hospitalizations will likely follow 10 to 14 days later. They can rush personnel to those areas if they know it's coming. But if they don't have accurate numbers, they don't know it's coming. Nicole?
Yeah, that accuracy certainly matters. All right, Brian, thank you.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.